Alright, in this video we're going to be discussing assembling and the administration of a nebulizer. So the nebulizer comes packaged with everything you need to get started. You're going to have your oxygen tubing, your extension tubing, the T, your mouthpiece, and the reservoir. So before we can administer it, we need to make sure that we're assembling it. So take the reservoir, put the T on top of the reservoir, assemble the mouthpiece, and you can either choose to hook up the oxygen tubing now or after you've put the medication into the reservoir. And then on the back end, you'll fit the extension tubing. So in this case, we are going to administer a neb, but I'm using normal saline instead of a medication so that you can actually see it vaporize. So you want to unscrew the reservoir. And most medication is packaged this way for nebulizer. It's pretty easy to take off in a minute and squeeze in. Just twist the cap. You can discard the cap. And then you want to administer it into the reservoir. So you just squeeze the tube till everything's in. You can see the solution in the reservoir. And then attach the lid again. So now we'll hook up our oxygen tubing. Plugs right into the bottom. And then the other end is going to go into the oxygen canister. Now when you're flowing a neb, you want to flow it between 6 and 8 liters per minute. So we're going to set it at 8. And you can start to see it vaporize. So now we'll administer it to the patient. And you want to instruct the patient to take a deep breath, hold it in as long as they can, preferably up to about 10 seconds, and then exhale slowly. The meds will take about anywhere from 8 to 10 minutes to administer, depending on how quickly the patient is breathing.